Welcome to The Doctor Is In. I'm Dana Nichols, your host today, and of course we're speaking to Dr. Randy Smart. Welcome, Randy.
Thank you, Dana.
And
great to be here.
Glad to have you. Now, you have agreed to talk about a topic that I'm quite interested in because it's a class of drugs that I occasionally use with some caution, and these are, it's kind of a mouthful, so tell me if I get it wrong, non-steroidal anti-inflammatory drugs. And the one that I happen to use is ibuprofen. Am I right?
That's absolutely right. That's perfect.
All right. But you said that maybe there's reason to be cautious with these drugs. So tell me a little about that.
So we all have a premise, and that is when a medicine is on the shelves in the drugstore, it's probably reasonably safe. The FDA has probably approved that. And so if you buy cough drops, you can take cough drops, or nose spray, you can use nose spray. And that's really a little bit of a stretch. Many of those medications and items have a certain amount of danger or concern about using them. And they can be safe under the right circumstances, but they can also really cause some serious health problems. And many consumers aren't aware of that. And we see many patients that aren't aware of that. We admit patients to the hospital because of this. And it's not an epidemic of any kind, but it's really important information, and I was excited about being able to share that with the audience tonight.
Okay, so I have a dear friend who was in a car crash many years ago and has some musculoskeletal stuff that has never felt really great. So when he gets aches and pains, he would at times use something called naproxen. Is that one of these drugs?
Yes.
But then he would not want to use it because it would bug his stomach. Is that one of the negative effects that we should know about?
That's exactly what I'm here to talk about.
Okay, well,
right.
Why does it do that, and how do you manage it?
So a little bit about these anti-inflammatory medications. They're not really new. And in fact, if you look at the history, it's really interesting. These medicines go back really to the Egyptians and the Romans. And what they discovered is if you took the extract of willow bark and you provided it to their patients thousands of years ago, their pain would improve, and their joint pain would improve, and their back pain would improve. And so that was actually related to aspirin. The substance in willow bark is an aspirin-like substance, and so that was used for years and years and years. And somewhere around 1890, a company called Bayer produced aspirin, and that was known as Bayer aspirin. And for 120 years now, that's been available. So they've been around a long time, but really, there are 20 available now in this country, and those have really only been available really the last 25, 30 years. So even though the history goes back thousands of years, they've only been around about 25 or 30, and they've only been what we call over-the-counter medicines really for about the last 20 years. So people have only really had that kind of access for the last 20 years. And there are, of the 20 that are available, there are 4 that are over the counter. One is called Aleve, which is the medicine you're referring to, naproxen.
Okay.
One is called Advil, which is ibuprofen. One is aspirin, which is available over the counter, and one is called ketoprofen. But Aleve and Advil are really what most people take. Most people pick those up off the shelf, buy them, and use them.
All right, so why does it potentially bother my stomach? What's up with that?
Right, so that is one of the complications. We call it gastrotoxicity, related to the stomach. And it's related to a couple things. One is the dose you take, and the higher the dose, the bigger the problem.
Okay.
And the second is the frequency with which you take it. So if you're taking that every day or multiple times a day, you're much more likely to have a problem than, say, 2 or 3 times a week. The class of medicine, when it interferes with inflammation, I don't want to get too technical, but it interferes with a substance in the body called prostaglandins. Mm-hmm. And these prostaglandins are very integral to stomach acid and stomach secretions. So somebody who takes Aleve or Advil at higher doses frequently can have much higher levels of acid in their stomach. Well, that acid is very acidic. It has a pH of 1, which is like hydrochloric acid. Mm-hmm. And it'll cause ulcers, it'll cause gastritis, it can cause bleeding, and it actually can be fatal.
My goodness.
Absolutely.
What's a high dose?
Right, so let's take Aleve, the medicine you mentioned. It comes as a 220 milligram dose. Mm-hmm. And if somebody were to take one of those or 2 of those at a time, that's not too much of a problem. Now, if they did that twice a day, that's becoming a pretty high dose. Mm-hmm. If they're doing that multiple days in a row, there is a cumulative effect, and that's even a higher dose.
Okay.
So 1,000 milligrams of Aleve a day is a high dose. 220 is a low dose. Many times you can look at the labeling on this medicine and get some understanding of that. But labeling can also be confusing. And so I encourage patients to read the labeling, but ask questions if it gets confusing, because labeling has a lot of legal input as well as medical input.
You talked about cumulative effects. Are there effects other than on the lining of the stomach that people should know about?
Right. So the stomach problem is the one we worry about the most. Okay. Because of the bleeding and because of the ulcers. That's reported to occur in something close to 15% of patients who take these medicines.
Okay.
That's 1 in 6.
All right.
If you do the math, Calaveras County, 45,000, that's a lot of patients. Yeah. So that's the one we worry about the most. But as we learn more, we know that there are other problems. There are other intestinal ulcers that can occur in the colon and the lower parts of the intestine. One of the things I worry about the most is kidney function. Now, as you know, we all have 2 kidneys, or most of us have 2 kidneys.
Right.
And kidneys are very susceptible to these medicines. What they do is they interfere with the circulation in the kidney. They have what we call a vasoconstrictive effect. So kind of interferes with the amount of blood getting to the kidney.
Okay.
So patients who are taking Aleve or Advil regularly are at risk for having loss of kidney function. Now, here's where the problem is. If in your example, you have a stomach problem, you usually feel it. Not always, but usually you say, something's wrong with my stomach. I don't think I'll take this stuff anymore. Mm-hmm. Well, if you have a kidney problem, you don't feel it. You would have no idea you have that problem unless you're really, really, really in trouble. So I saw several cases today of people who had lost 20, 30% of their kidney function today as a result of taking this. And now they don't know that until we do the test, and it's a simple blood test. But they don't know that. They don't feel it. They just feel better because the medicine helps them. And so that's what I worry about.
Kidney function, it's one of the organs that cleans toxins out of the body?
Right. They're filters, and they filter toxins out of the body, produce urine, and not everybody is at risk for these kidney problems, but definitely diabetics, often people with hypertension, anybody who's got an underlying kidney problem to begin with, and there are many. But the ones I really worry about and are published are the diabetics.
Okay.
Most diabetics do not have normal kidney function to begin with. So they have some vulnerability, but when you add some Aleve or Advil to that, they get into trouble.
When do they find out about the trouble? I mean, what would be happening at that point?
Well, many of them would not know about it. Now, not all diabetics have doctors and have a source of primary care.
Okay.
Many do not. Many do not even know they're diabetic. I can't remember the exact numbers, but something like 20 or 30% of diabetics are undiagnosed.
Okay.
But for those that are diagnosed, they would find out about it when the doctor does the routine blood test they do as part of their diabetic appointment. So the patient would come in, you would review the blood test, and you would say, hey, what is wrong with your kidneys? And 10 minutes later, you would realize they had started taking Advil for back pain or joint pain, headaches.
Okay.
People take a lot of these medications for headaches, and they're wonderful. They help the headaches. I mean, it's absolutely a great thing to do. Many people will take the medicines for menstrual cramps, and if you ask them, it's nearly life-saving because the cramps are so bad, and these medicines like Aleve or Advil will really, really help them. But they don't necessarily know that it affects their kidney function and their diabetes.
So if a person can have damaged their kidneys but not know it, then why is it a problem, or does it not get to be a problem until there's some tipping point where the organ isn't doing its function?
Right. So it can be progressive. and diabetes in and of itself can have progressive renal damage. So typically in this scenario, the diabetic will take the Aleve or the Advil. Their kidney function will deteriorate over, several years, 2, 3, 5 years, a little bit of variability in there. And ultimately one day somebody will say, well, your diabetes has basically destroyed your kidneys and you may need dialysis and you're sick. And you don't turn back, you don't go back. I would say the majority of dialysis patients are diabetics. And some of that is probably fueled by what you and I are talking about. Some of it is the natural history of diabetes. But there is a tipping point.
So you don't necessarily know all the causes for the deterioration unless the patient is a good historian and you can figure out, there was a whole bunch of use of these drugs.
That's exactly right.
All right.
That's exactly right. And it's truly one of my favorite words, multifactorial.
Okay.
Because hypertension plays into that, diabetes plays into it, NSAIDs play into it.
So, but you would advise people to be more cautious. If I'm already at risk because I'm a diabetic, maybe be more cautious with the non-steroidal anti-inflammatories like the Aleve or the ibuprofen.
Extremely cautious.
Okay.
In fact, I would say if you're diabetic, you shouldn't use these medicines unless you've discussed it with your doctor.
Wow, that's good to know.
That doesn't mean they can't be used. They can be. And for example, in my practice, diabetics are using this maybe a couple times a week with monitoring and doing perfectly fine. But without the monitoring and without the professional insight, it's risky.
Okay. Can you tell me what things you can treat with these drugs and when it's clearly appropriate to use it?
So the drugs sort of have three systemic effects. One is they treat pain, whether that be tooth pain, headaches, whatever pain you have, they treat pain, independent of these other effects they have. And number two is they have a great anti-inflammatory effect. So if you have a joint that's inflamed, like a tennis elbow or a shoulder or your back, and there's any inflammatory component to that, these are wonderful. They're truly life-saving, quality of life. And it would be appropriate for somebody to use these from time to time, Advil or Aleve, for back pain, for joint pain, knee pain, hip pain. They are, I mentioned this earlier, they're used for headaches,
Okay.
which are common. They're used for menstrual cramping, which are common. Actually, ibuprofen was invented by a chemist who used them for hangovers. And they worked. They worked wonderfully, but that really is not a good idea.
Okay. Because you've already stressed your kidneys,
Right.
right? And that's not the
It's kind
time.
of bad behavior.
Okay.
Right.
So you mentioned the pain and the inflammation, and is it an antipyretic effect? Is that the other thing?
Right. So there are diseases, notably infections, but other diseases that cause fever. Mm-hmm. And there's really a debate in medicine about whether fever is beneficial or harmful, and we still haven't solved the problem. In 2016, we still don't know. We don't know whether fever is a good protective thing or a harmful thing. Mm-hmm. But if you were to take Aleve or Advil, that fever would go down. They do that. That's the antipyretic effect.
Okay.
So those are the three effects these medicines have.
Okay. Now, if I'm somebody who maybe, let me ask this. So let's say I'm not a diabetic, but I like to run, I'm physically active, but occasionally my knee bugs me. How often could I use this before it would be a problem?
Right, so there isn't an exact answer. I will give you my opinion, and I think there are probably other opinions, but I would say if you're using this every day, you should probably talk to the doctor. If you are using it at higher doses, like the 500 twice a day of the Aleve, if you're using higher doses, you should probably talk to the doctor. If you have any side effects, and there are other side effects you and I haven't talked about, one, you should probably stop it. But if you had an interest in continuing it, you should probably talk to the doctor. But let's say you're the average guy in Calaveras County. You had some knee pain because you're a runner, and you took some Aleve on a Friday and a Saturday, and you're not taking it every day. There's really no problem with that.
Okay.
That's perfectly acceptable and encouraged because they're helpful.
Let's say I'm starting. What would an alternative be if I'm and maybe we should say alternatives for different symptoms. So if I'm having headaches, and I realize that I don't want to be taking this as much because maybe I'm a diabetic or whatever, is there some alternative to treat a headache that might not be problematic?
There are alternatives. One of the medicines that you can buy over the counter is acetaminophen, which I think one of the trade names is Tylenol.
Sure.
And acetaminophen is not an anti-inflammatory. It's not an NSAID. Different mechanism of action, but it's very effective at treating pain and the kinds of pain you and I are talking about. Say a headache, bad day at work, headache, want to take something, back pain, joint pain. So acetaminophen can be taken without the same risks, and I encourage patients to do that with a couple precautions. Nobody should really take more than about 2,000 milligrams of acetaminophen without some professional prescriptive input.
Okay.
Now we do use higher doses in patients, but I think extra strength Tylenol is a 500 milligrams, so
Right.
somebody could take 4 of those a day without much risk. When that is a bad idea or a worrisome idea is somebody who has anything wrong with their liver. Acetaminophen is metabolized by your liver, and it is a little bit unfriendly toward the liver. So anybody who has an underlying liver problem like hepatitis C, alcoholic liver disease, there are a bunch of congenital liver diseases. Anybody who has an underlying liver problem should really talk to the doctor first before taking the acetaminophen.
Okay.
And then somebody who drinks a lot probably should be pretty cautious with the acetaminophen because the combination of the alcohol and the acetaminophen together can destroy your liver. And I've put people in the hospital for that exact reason.
Okay.
The scenario is somebody drinks a lot, they wake up with a headache, they take a handful of acetaminophen, and they do it day after day after day. And in a short period of time, they turn yellow and
Heavens.
fill up with fluid.
That's ghastly.
Right.
Okay.
That's awful.
Are there any fairly low risk ways to treat pain, or do all of them have?
Absolutely.
Okay.
So one, little bit of philosophy here.
Okay.
Sometimes it's okay to have pain. So you have a little
That's
pain, be a little bit tough it out. It's your body telling you may be overdoing it a little bit, or it's information that could be helpful to you. So you may want to change your activity rather than just try to wipe out the pain. So I encourage that. 2, there are topical medications that I think are very effective. They are over the counter, some are prescriptive, that have these anti-inflammatory properties. An example would be Bengay. And there is both odorless Bengay and then the locker room Bengay. But Bengay actually has a medicine in it called methyl salicylate.
Methyl salicylate.
Salicylate is like aspirin.
Similar to acetylsalicylic acid, right?
Perfect.
Right.
And so the absorption of methyl salicylate is very good. And if you take that Bengay or methyl salicylate, let's say you have some hand pain because maybe you're a golfer or racquetball or maybe even a logger, you can take a dose of that twice a day, really rub it into those hands, and the joints will feel great. There's no systemic toxicity that I know of.
Excellent.
Absolutely none. The only way you can get in trouble with Bengay is if you mistake it for toothpaste. And then you got a problem.
Yeah, okay. That makes sense.
There are similar products out. I believe Icy Hot is also a methyl salicylate product.
Okay.
That can be used. And then we have some prescription things we can use. One is called Voltaren gel. It's an anti-inflammatory gel. I believe it's made in China. And it works wonderfully. So there are topical things. And then there is another thing that we commonly forget, and that is the physical therapists. And the physical therapists can be just so helpful in these kind of situations. My knee hurts every time I run.
Sure.
My shoulder hurts every time I golf. And you don't have to marry the physical therapist. You can go in for one appointment and describe that problem. And I believe now you can self-refer. And they will give you better information on what they think the problem is. They'll give you home exercises that'll help alleviate the problem, and a kind of a modified workout, run, golf, whatever. And that can be very, very effective without taking a single pill or anything out of the drugstore. Often we forget about that.
Excellent, excellent. What else have I not asked that we ought to cover about these medications?
Well, more recently, and this is what triggered my thinking a little more about these, we have seen more reports about higher rates of cardiovascular problems in patients that take these medicines. And as you probably know, the number one reason Americans die is cardiovascular disease. And even though we've lowered those numbers tremendously, they are still the number one reason we die. And when you look at groups of patients that take NSAIDs compared to those that don't, significantly higher heart attack rates, stroke rates.
Okay.
And we don't really understand why.
It's a correlation. You don't know if there's a mechanism.
We don't know what the mechanism is.
You don't know what the mechanism is. Okay.
So in the last 3 to 4 years, we've seen more and more of those reports. So patients who have underlying cardiovascular disease, we really try to keep them off these medicines, particularly during the acute phase of their illness.
Okay.
But even anybody, say you had a cardiac stent 5 years ago, we would really try hard to keep you off of these because we think it could potentially accelerate that and cause a bigger problem than a sore shoulder or a sore knee. Last year, we started seeing more and more reports about heart failure. And heart failure is when the pump just can't pump strong enough.
Meaning higher rates of heart failure in people who are users of these drugs.
Correct. And initially I thought, well, this must be the heart failure patients that are getting worse. And that's not what it is. I mean, there is that, but it's people who have never had heart failure and don't have a reason to have heart failure that they're seeing more heart failure in.
I'll be darned.
So
any speculation on what's going on?
Dana, I really don't know, but I know this. When these reports come out, you have to be a little bit careful about over-interpreting them or applying them to practice. But these reports now, there are multiple of them, multiple institutions, reputable institutions that are saying this is real. Now the numbers aren't striking. The numbers are 1 to 2 per 1,000. Okay, Calaveras County has 45,000 people. Yes. 1 to 2 per 1,000. That's a lot.
That's a lot.
Yeah, it's a lot. So particularly when you step back from the epidemiologic view of the county or the community or the state or the nation, this is a big deal.
Yeah, we're just about out of time.
No.
Yeah, we are. Thank you so much. This has been fascinating. Any last comment about what you would do the next time you have a headache?
The next time I had a headache, I would probably go out and take a big long walk and maybe get some more water.
Thank you, Dr. Smart, for coming.
Thanks, Dana. I enjoyed it. Thank you very much.
This has been The Doctor Is In. Thank you for coming.